There you go. Well, welcome. I hope you brought questions because I didn't bring any. Um, and I guess my main goal here is to be available to talk about the way I practice Chinese medicine, which is via the 5-channel system that I learned from Jeffrey Yuan. I started studying with him in 1998. So for a long time. And I taught at the school here in North Carolina for 7 years. And for about 15 years, I had a full private practice. And I was very determined to employ these styles of treatment. So um, for the first 10 years, I struggled to do it in the usual fashion because some of these styles of treatment require a lot of treatment, especially. And then in the last 15 years, I have mostly been offering them in retreat settings, so that it can be a very intensive situation for people. So that I've actually done several 18-day retreats, usually at least one a year, which is the amount of time for the divergent channel system. So those are pretty amazing to do. And yeah, so for me, that's part of the classical magic that the treatment happens in a concentrated way and is not played out over, the once a week for however many weeks kind of thing. And so it's a very different style, feels very different. And in my experience, it's amazing how well it works um, when you can employ it in that way. And what I've been doing in the last several years is inviting people to work with me in the clinic um, for several days. We've been doing 3 days, but I fantasize about doing a whole week or even 18 days. I have fantasized about doing 18 days with people. So, just because the way that that feels is so different and so much more so much more in keeping with the old ways of working with people that in traditional cultures, especially in Chinese culture, the person who was doing the healing work was part of the community in such a way that they knew everything going on about that person's life. And when the person was ill, they would come and be with them until they could be better on their own. And um, that has always been very compelling for me. So I think that's why these styles were so attractive to me. And they go deep and they require a kind of, I don't know, depth of care that I think is not often found. So, so that's a little background. And now the floor is open. Um,
I,
And I hope you'll all be brave and I'd love to see your faces if you can. It makes me happy. Yes, and yes,
um, I'm curious about that retreat thing because I haven't found a clinic yet now that I've relocated and my list is growing and I'm getting people sort of saying, oh, when can I come and see you? And I'm thinking, well, it hasn't manifested for a reason, you know. And the idea, I've done retreats before in my life and held retreats.
yeah,
And the whole you said 18 days, right? Was a good amount. My experience of having channel treatment on myself is that it's like the door opens and it never closes. So
mm,
I'll have an experience in a month or, after, say, attending a workshop. But then it's like you try and close the door to reduce the experience. That's what I do. But it just keeps blossoming out.
Mhm.
So, yeah, you can't comment on that.
Well, that sounds fabulous if it keeps blossoming out. And I have that experience also, that especially on the eight extraordinary level, when you go deep, it can take a long time for it to roll out. But
Mm.
for me, I have focused in my practice on people with autoimmune diseases or cancer. And what can happen in 18 days is something revolutionary, really. That the a level of change can really go beyond, it goes beyond what most people conceive of. I just spoke with somebody who was my client who was diagnosed with multiple sclerosis. And she did a year of retreats. She didn't do 18 days with me. She did 3 days at a time with me. And then because she was also an acupuncturist, she went home and she did treatments at home and with other people who were guided by my instructions. And she now she's had complete remission and no change in the lesions that were discovered, and it's 3 years. So, that's quite remarkable and wonderful. And so for me, for many years, I did the retreats here in my home. Again, because that's the way it felt to me. I like to cook for people, so I would make all their meals and give them treatments and do workshops as well, like teaching them how to cook or teaching them how to do qigong or how to meditate. And so that was all part of our time together. And the other piece about being on retreat is you get the yin part, right? The needle treatment is very yang and very activating, but you have to have integration time, especially when you're treating at that deep level, at the level of eight extras or divergence. It's very important to have time to integrate, right? To let the body actually receive it. So that's one of the amazing things about it as well. And so, you can do this even in a day at a time, in my opinion. That again, this is a kind of care that people don't often get in our culture, especially. Everything is like hurry up and get it done and make it better and go back to work, right? But if you take the day off, even an hour or an hour and a half treatment in a day context, in a vessel that actually allows for integration and conversation and a meal and meditation, it actually allows the person to bring their whole self in a very different way. And the clinician, you can bring your whole self in a very different way also. Yeah. Yeah.
Thank you. That sounds amazing.
Yeah, yeah. And again, my fantasy was to have a bunch of clinicians together because I love to be in the clinic with people and for us to work together, work on each other as well as bring in clients. And this is a way, again, to experience the quality of attention that changes when you do something for an extended period of time together. So, yeah, that's the heart in the clinic. Um, which, like I said, originally I planned for it to be for 5 to 7 days, and I've been doing it for 3 days just because that's more convenient for people. Yeah. Mhm.
Was those 3 days at your place or at a different spot? Yeah.
Well, right now the Heart in the Clinic is being hosted by one of the people I've worked with for many years in her clinic because she has a good space for it. In my home, we can do that with 3 people, but we can't really do it with more than that. So, in her clinic, we can probably hold up to 6 people or even 9, um, because she has several treatment rooms and a big space where we can meet together. So, yeah, yeah. Welcome, Nicola. Yeah.
Um, so could I just ask a little bit or just mention, I've done the Heartland Clinic at Josephine's place, and the MS client that Josephine was talking about before, I think that's the same person.
Yes.
She had quite active symptoms when she first came. Is that right, Josephine?
Yeah. Yeah,
Yeah.
that's right.
So
Very scary for her. You know, she's an acupuncturist and she lost the use of her arm, and she was very and had dizziness and other symptoms that were very scary for her. Yeah.
and her father had also passed away with MS. So
Yeah.
these symptoms felt like they were escalating quite rapidly. And we were fortunate in the Heart and the Clinic to have that dialogue with her. And she was also very willing for treatment as well. So
Yeah.
Josephine had already had the history with her and working with her. And then she shared her story. And then we also got to treat her. And then Josephine also created essential oil blends, which was another way that she took away with her and continued to treat herself. So like when you're talking about the rolling out of these things, it's almost like planting the seed and then allowing something to blossom afterwards, because it's now created such different perception in the way that you treat as for her, but also for me as a participant. So it was really extraordinary, the Heart and the Clinic, to have that opportunity. And we share meals and we, contemplate and discuss the channels as well. That's awesome.
Thank you for sharing that. Yeah. Yeah. Yes.
Hi, Josephine. This is interesting that you're talking about the doing retreats, because where I have my clinic, it's a friend who owns it's a house, and he wants to turn it into a retreat, specifically for kind of chronic care conditions, which is sort of exciting, but it's sort of daunting because I've got to figure it out with him, like how much work does he want me to do? But hopefully we can find some support there. But what I'm interested about is, are you just using oils, or are you using herbs during your retreats as well? Or is it just acupuncture?
Acupuncture, I do write herbal prescriptions. I use oils, and I also write prescriptions. I also use stones. So the
Cool.
whole materia medica, has stones. It has oils and herbs. So I do all of those things. Yeah.
Okay. I did have another question around so you're just opening this up you're advertising it as like a retreat for chronic conditions, or are you just finding the people who are coming through your clinic already?
You mean in the Heart in the Clinic?
Yeah, like these retreats that you're running.
The Heart in the Clinic is for practitioners,
Yeah.
and you can bring your clients. If you come here, for example, the clients will come from the person who's hosting, most likely, because she's about 4 hours east of me. Um, if it happens in Australia, it will come from people there.
Okay.
So sometimes I will ask the clinicians who are participating to present the case, because it won't be my client. It happened in the case that Joe was talking about, that it was my client, but in other places it will be other people's clients. Yeah.
And when you're so I think Joe's organizing for you to come out to Australia,
Yeah.
and what were you going to share with us?
Well, I was going to offer the Heart in the Clinic if people are interested. Also, we are talking about offering what I call the three-legged vessel, which is a classical view of the primary channels, just to introduce people to the way of thinking about the primary channels from a classical point of view, which is it's a way of working with the primary channels that I developed in the clinic here in the school, because our third-year students were required to use the primary channels. They weren't allowed to use the eight extraordinary and the divergence and the lows, and so in my enthusiasm for classical thinking, I created this way of working with the primary channels to help people think differently about them. So it's different than what Jeffrey is teaching and what my friend Anne is teaching. Some of you probably know her. Anne and I met in New York when she was still a student in acupuncture school, and so Anne is teaching more like what Jeffrey teaches, which is a view of each channel as a complete entity, you could say. And I'm teaching people how to use the existing traditional Chinese medical textbooks from a classical point of view. So it's different, and it's also easy and fun and very effective. So, like I said, I worked in the school, ran the college clinic for a number of years, and developed this for those students so that they could have some exposure to the classical way of thinking and also have an easy way to employ it. And it's very helpful. The last Heart in the Clinic that I did last spring, we focused on the primary channels, which was a sort of a surprise. I never know what people are going to want to focus on, but it depends on the people who come and what their interest is. So I go by who's there and what they want to talk about and who they bring to the table. Yeah,
Great. Thanks.
you're welcome.
Josephine, I've just got a question. If you were to do the Heart in the Clinic, would it matter if you were still relatively new to classical Chinese medicine?
It's a good question. I think if that were the case, it would be good to do the three-legged vessel also, as preparation. And the way we were talking about it, we would set that up so that the three-legged vessel would happen before the Heart in the Clinic so that people could do one and then the other. And that would probably
Yeah.
be helpful but you can also do the there's something called body geography that I've created that's online right now.
Okay.
That is a little more of an overview of the 5-channel system. So it's also a good introduction for somebody who already understands, Chinese medicine.
Okay.
That can be a good way into. And again, I'm willing to work with wherever you are. So it's gonna be up to the people who want to be there. Yeah.
Great. Thank you.
Hi, Josephine. My name's Caspian. I'm reside in South Australia and would be very grateful if you did come here. Because not many people do come this far south. But thank you for your time. And I just wanted to ask, 18 days, let alone 3 days, is an incredible amount of energy output, especially if you're, cooking meals, not only physically, but emotionally.
Yes.
Mentally. So I wanted to ask you, how you dealt with that. And the second part of that question is having people in your home. How do you separate your home space with the clinic space? Because I've just started a home clinic as well. And if you have any techniques as far as Qigong or other techniques that you can share.
Yeah, such a good question. And it's I'm laughing because I made the decision just last month not to do them in my home anymore. And I have done it for 30 years. I've almost never not had my practice in my home. So and I've mostly done that by having I have a separate space for people when they have stayed in my home. They have their own bathroom and they have their own place to sleep and place to rest. And I give people very specific guidelines about where we're going to do what and when we're going to do what. So I create a container that way, and I'm available to people 8 a.m. in the morning to 8 p.m. at night. But after that, unless it's an emergency, I'm going to be in my own space and they're going to be in their space. I have also rented homes where, again, if I didn't feel that I was ready in my home in one of the places that I've lived, I didn't feel like it was adequate for older people because the place to stay was up a steep staircase. So I rented a place instead, and I just went there every day. I just showed up every day. And the other piece that happens during 18 days is that half of those days are rest days. So there's treatment days and then there's rest days. And on rest days, we are resting. There's not as much interaction. And so I'm resting, as in I'm reading or I'm resting or I'm cooking, but we aren't having conversation necessarily. So conversation is restricted to, again, times when the floor is open, so to speak. So I just make times where it's not open. And people are good with that. Again, it's I would say I was influenced and brought up in the Buddha Dharma before I ever went to acupuncture school. And so my reference point for retreat was based on the retreats that I did in those contexts, which you may or may not know are very monastic. In other words, they have a schedule that's very set. This is when the meals are, and this is when, your practice is. And so that I was coming from that orientation. So I just continued to do that. And for me, the lack of separation, meaning it's ordinary life, your illness, your body, you don't get to like leave them at the doctor's office, right? You have to have them all the time. So there's a way in which modeling your own healthiness, the way you care for yourself is actually really helpful for people. So, I was, yes, it can be stressful to have somebody with you all the time for 18 days, but also, we do live with people, right? In other words, we do live with people, and you're modeling how to actually have a good boundary and how to be healthy in that boundary. And one of the things I say to people all the time is health is not the absence of disease, right? It's the presence of a person in their life, in their experience. So if you're giving them presence and you're clear about that, then there isn't any problem. It's all natural, right? It's all natural. And it's natural to be sick and it's natural to be well, right? So and it's not for everybody. There is no question that, it's not a style of practice that's for everyone. And you can find ways to do these styles of practice in a regular practice. It's just harder, in my opinion, but that doesn't mean it is for you. It could be perfectly easy for you to do it the other way. And it helps to have a separate space for sure. I have had in my home in Vermont, I had a separate building, which was the best. And in different homes, I'd have had different arrangements. Yeah. And as I was thinking, David, when you were talking, if somebody has a house that they want to make into that kind of a space, it's really helpful to have a team, right? To have a group of people and collaborate so that not everybody has to be always on call, so to speak. And that would be wonderful. And you could still come together on treating people in that way if you wanted to. Like if everybody was on that same page, it would be beautiful. That would be really great. Yeah.
So I've got to experience having clients who have needed it to come, where they've been in chronic sort of healing conditions where they've been forced to completely change their lifestyle to get better, and they've made the decisions that that's what they wanted to do. and I've had the opportunity to support them in that time. So I've got to witness, not a lot of times, but a few times I've got to witness like the difference it makes if someone's coming 3 or 4 times a week, or I can concentrate the
Mhm.
treatment strategy.
Yes.
Yeah, and I know how much more profound it is.
Yes.
So when did you start to implicate this concentration of treatment for yourself? Like,
It's funny, the woman who was my first retreat client just passed away. She came to me in 2004 with a lymphoma that was non-specified, and nobody knew what to do with her. At the time she came, she had a stomach tube because she had had radiation to the tumor in her throat, and so she couldn't eat. And she basically said to me, "My husband needs a break." So that's why I've decided to sign up for a retreat. And that retreat was 5 days. Um, so yeah, so 20, whatever that is, 21 years. And for me, again, it was a year after I had purchased a home that had this extra building on the property and had a spacious lower level that had my office in it. So it was a very easy setup for having people in my home. And I was very excited about it because, as I said, I love to cook for people. I love to make I like to make the treatment part of life, like just I don't want to say casual because it's not completely casual, but in a way that makes it easy for people to investigate that kind of change. The treatment is pushing them, and they sometimes need a lot of support. So yeah, that was when I started. And while I was here, when I first came here, um, and I was teaching a lot, I did fewer, but I probably have done at least 2 every year since then. Some years more like 6 or 8 retreats, depending on the length and the people involved. Yeah. Yeah.
Was just wondering if anybody had any questions or like clinic cases or anything like that they wanted to ask Josephine.
Oh yeah. Feel free to test me. I really do love to do cases.
I have
Oh,
a case that we can talk about.
sure.
I have a patient who's probably 6 weeks out from having his prostate removed.
Okay.
And during the PET scan for the pre-surgery PET scan that he had, they found a tumor in his lung.
Okay.
He's a 50-year-old male.
Okay.
I've treated him for like the last 4 years. Something happened about 4 years ago where he just started getting like very swollen lymph nodes in his groin, and getting a lot of discomfort around like the diami. He originally had like a varicose seal, and had a surgery for that, which was successful and helped a lot. But he always had this high PSA, and then eventually recently they removed his prostate. But now he has this other tumor. They don't know. They're just going to watch it. They don't know if it's malignant or benign, so they're just going to keep their eyes on it. I can usually see him about once a week, and he definitely has this fire toxin that's hard to control.
Huh.
Uh,
Tell me more
like
about that.
his tongue is like so eroded, like the huge cracks in it, multiple huge cracks. You can it almost looks like you can see tumors growing off his tongue. Like it's pretty bad. If I can try and send a picture of it, maybe. Probably too complicated for me to do that.
Yeah.
Yeah, and I think, he was in a relationship maybe around 10 years ago. He has a child. He lost a child. He had a daughter that was born. She lived for 2 hours, and then she died. And then after that, he went into like a chronic fatigue kind of viral episode that lasted about 2 years. When I ask him about the grief, he just doesn't go there at all. And I feel like this is the huge
Yes.
part that he hasn't processed.
Yes.
And it's kind of consuming him, and that's sort of like this source of this.
Yes. It's preventing his lungs from disseminating the moisture properly. So
Yeah, that's
the prostate tumor is, I assume they removed it because there was a tumor in the prostate also. Is that true?
yeah, they removed it because there was a tumor in the prostate. That's right.
So, well, lots of things occur to me, but prostate tumors are generally dampness. Anything like that in the lower body, dampness is the preceding factor. And you can see on his tongue that the damp went down and the fire went up, which is not normal, but that's how damp goes down, and that's how fire goes up. So once that daimai is working to do both things, right? Daimai will integrate upper and lower, but it will also protect, right? It will also kind of seal off that lower jiao in order to contain something, and then that becomes a tumor. So with the removal of the prostate, that containment was lost. So his, daimai has been insulted, so to speak. And it was telling you before the surgery that all that swollen lymph nodes, it was just telling you about that dampness, right, going down there. That was, and the varicocele. Those are all damp, damp. And damp over time, cooked by that body heat, it becomes fire toxins. It becomes malignant. That's how most cancers happen. And it just sort of depends, like in the upper jiao in a woman, like breast cancer, that's because that it gets trapped there because of the way a woman's body works and the way their hormones work. That dampness gets trapped and it gets cooked even more by the heat because it's in the chest where where there is a constant bellows, you could say, fanning the fire, which you can see on his tongue, right? And so now, so in order for that grief to be allowed to work its way, there has to be moisture, right? There has to be moisture. They have to get those lungs working properly. Now, that is difficult if you want to prevent the dissemination of, like, it's be good to know if that is malignant, because if it's malignant, which is very possible, right? The lung and bladder connection is and the lung and kidney connection, because prostate is part of the kidney system, then I'd say it's a good probably 60 to 70% that it's malignant. That would not be a surprising place for it to go. So it would be good to know, because when you start to reset the lungs, the lungs are disseminating qi and descending qi and disseminating fluids, and you want that to happen. But if there's malignancy, the risk is that again, metastases will continue. So you have to be careful, especially with herbal medicinals, to regulate and stay away from moving the blood, because the blood is what carries metastases. So in my experience, and I had a patient exactly like this. I had a patient who had originally prostate cancer, prostate removal, then lung cancer. And when he came to see me, he had lung tumors that were too large. They didn't want to operate, and he didn't want to do chemotherapy. So we did herbs for a year. And in that year, those tumors were reduced to such a degree that they were willing to operate on them. And when they went in to operate on them, they said it was going to take 6 hours and it took 2 because those tumors had reduced so much. So it is, it's both easy and a little bit tricky because the lungs are constantly moving. So you have easy access and they're very receptive to medicinals and to acupuncture because they're chi movers and so is a needle. And, so they can respond very easily. But you want to be careful not to move the blood and encourage metastases. And you want to treat those tumors like phlegm because that is what they are, most likely, right?
Use something like Chingpi.
Well, that's a whole,
That
not
like just
on
like
its own,
something to start
not on
breaking it
its
up.
own, not on its own.
Yeah.
So,
Of course, not on its own, but like something to just go in and start breaking it up.
well,
Because I
because
keep
of the
thinking
way
like
you're,
along the lines of like Maimendong and
yes,
Jumu and like these nourishing sort of fluid building to build enough fluids to get something to move, but something got to break it up as well.
oh yes, and Chuan Bei Mu is your first thing. Chuan Bei Mu and Tianhua Fen. You want things that are gonna dissolve phlegm and moisten at the same time. And the thing to be careful with my Mendong is that it will actually cause mucous membranes to weep. Like my Mendong, you can actually get nasal discharge. You might want that at some point because that might be helpful. But depending on his various other complaints or how his body is responding, you're going to want to modify. Qingpi is very drying, so you want to be careful not to dry it out anymore with his tongue like that.
Mm.
So it's going to be you'll work with it. The other formula that I really like is uh, Xuanshen and Beimu and uh, I'm gonna remember Muli, I think. No. Anyway, not Muli. What's the other one? The,
Longer.
the turtle shell.
Beija.
Beja. Yeah, Beja. I'm not sure if that's the original one, but that's a great one for softening phlegm, right? For softening the phlegm. You want to soften, you want to moisten a little bit and allow it to dissolve without moving the blood. Yeah.
Okay.
But it's good to know, it would be really good to know if that was benign or malignant. Because if it's benign, you can worry a lot less about moving things. But
Yeah.
he'll feel a whole lot better and he'll have a lot more energy for grieving and for allowing things to move if you can get those lungs regulated.
Yeah.
Yeah.
What about,
Thank you.
sorry, can I input there a little bit?
Yep.
What about using essential oils?
Oh,
for-
absolutely. Absolutely. Those would be very helpful. And for grief, the main one is cypress essential oil, which descends the lung qi and clears damp heat and helps people process grief, especially along with eucalyptus. And you would want eucalyptus polybractea, which is the one that dissolves phlegm the best. So for external wind, you use the Eucalyptus globulus, but for something like this, you would be thinking about the polybractea. Yeah. Or the Smitty sometimes, but polybractea is probably the best. Yeah. And you can do that with a steam so that the essential oils actually get into the lungs themselves, or you can do it as a chest rub and lay a warm washcloth over it. That might cause some skin irritation, so you want to be a little careful about that. So you might dilute it. If you dilute it, you might want to use something like cauliflower, or you can use grape seed. These are things that are going to help resolve phlegm also. And you can also, what's the other one? Why is it escaping my brain right now? But those are
Use castor oil, or is that?
castor oil is good too. Usually that's lower jowl, but you can also use almond oil in the upper jowl. But cauliflower and grapeseed are more dispersing overall.
What about using like lotus root powder mixed into a paste with oil in it to kind of spread?
Certainly you could try that. Yeah, like a plaster, you mean? Yeah, yeah, sure.
Then
Sure.
you wear an old t-shirt over it and
Oh yeah, you don't want anything you care about with the oils like that because it'll get on your shirt. Yeah.
And from an acupuncture perspective,
From an acupuncture perspective, especially if this is malignant, you're going to want to be on the 8 extraordinary, especially if he can only come once a week. This looks like second confluence to me, of the divergent channel system. But if he can only come once a week, and if he's a little resistant to taking care of himself, if he has some inhibition about actually going through the process, it would be better to work at the 8 extraordinary level. And of course, Renmai would be my first choice because it's very containing. So if it is malignant, I would be trying to contain it. I would be trying to enhance the yin, because yin is what keeps cancer in remission. So I would want to enhance the yin and use medicinals that help to consolidate rather than to disperse. So again, that's a little tricky, but the way I would think about that is that I would use the medicinals to nourish the yin because they're better at that. And I would use the needles to regulate the lungs because they're not going to risk moving the blood in the same way. So that's a good combination and an easy one, right? You can do the Renmai, or you could even do the primary channels to regulate the lungs, and he'll feel a lot better. And you can use the medicinals to consolidate if indeed that's a malignant tumor. Yeah. And I have to say that framework for working with cancer is very important and very helpful to understand when you're consolidating something and keeping it in remission. It's counter the Western mindset. The mindset is it's toxic, get rid of it. It's a war mindset. And I always say, if you make war, there will be casualties. So how about if we don't make war? Right? How about if we say instead we go with, not against? If this body does not have the resources to stop that cancer, let's consolidate until we have the resources. And at that point, you can decide. From the person I mentioned earlier who just passed away, I got a note from her son who said that he thanked me for keeping her alive for 20 years past her prognosis. And all I can say is all I did was talk to her about consolidating the yin and taking care of herself so that her body had the resources to keep going. I didn't talk to her about getting rid of the cancer after the first year, when it was active and she was younger. at that time. So she was in her 80s when she died. Yeah.
Would you use Dymai at all, considering that you've had something that removes that damp that was in the lower jowl, and now you've got this venting
Sure.
of the heat?
Sure,
the-
you could certainly use Dymai to consolidate. You can use Renmai and Dymai together. But it really depends on how he's feeling after this removal too, because sometimes with depending on their lifestyle and what he's eating and all of that, he might need draining still in that lower jowl to prevent recurrence. And you might need to drain first. And it would be okay to drain the Daimai and consolidate the Renmai. So the Renmai, it's like a straw, and the Yin Chao Mai is like the putting your finger on the bottom of the straw. And the Daimai, it's like the belt that you tighten around the middle or you release it. So you couldn't put you don't want to put the finger on the bottom of the straw if there's extra dampness and crap in the Renmai. Then you want to drain first and then you can consolidate. But when I say drain first, I mean for a short period of time. Because if he's already tired, if he's still fatigued, he's not going to feel better. So you have to, yeah.
His recovery has been they didn't do any nerve damage when they removed the prostate.
Well, that's good. That's
Yeah,
good.
so he had urinary function back within 3 days.
Great.
His erectile function is slowly coming back, but he's trying to take it sort of easy and let himself recover before he tries too hard. He's exercising, he's swimming in the pool, he's doing like 20 laps at a time. He can ride his bike. He's doing very well.
Great.
Like energy sort of coming back.
Great.
But it's also a little bit feels like it's all on the outside, if you know what I mean. Like he's doing too much because he feels good.
Yes.
And still the fire's smoldering away on the inside, and the damp's accumulating to try and control the fire. It's all still the whole thing's still happening,
Yes. So regulating the lungs is really going to help him.
Yeah, and
Swimming is great for that too, by the way. Right? Swimming is great for the lungs. So he's intuitively going towards something that's going to help him.
Yeah.
And he won't be able to work with that grief until he has the moisture available. You can think of it that way. Like he's too dry now to go inward. To self-reflect, you need a lake to look in, right? So he doesn't have that lake. It's been drained. And surgery is a great intervention, but it is also shocking to the body and all the way it's just gone. And depending on how well the anesthesiologist did with the anesthesia, he could, have fallout from that, which there's all kinds of things that can happen. But
he was pretty post surgery. He was I actually had to go to his house because he couldn't move, and he was, he felt like he had he'd picked up some kind of entity during his, being in the hospital, and he was not himself at all. He was really knocked around, and that's, a good place to pick something up, a hospital, when you're when you're on a lot of anesthetic, you're wide open.
Right. So there might be some of that has to happen before you can actually consult.
We worked through that. He sort of came back to himself and he's feeling better. It took, we sort of worked through that already.
Oh, great.
Now it's just, we're sort of back into our weekly routine where I usually am treating 8 extras. Yeah. Renmai a lot. Yeah.
Great. Lovely.
All right. Cool.
Thank you for sharing that. That's a great case. Yeah.
I have a case that's it's so similar, but it was ovarian cancer, and it's mirroring your description there, David, so much. So this has been really helpful. Thank you.
Yeah. Great. We have a few more minutes. If anybody has any either questions, I'm happy to entertain didactic questions as well as cases. I love to do cases, but you know.
I have a
And-
quick one. Oh, I hope it's a quick one. I have someone who has blinking problems. I mean, I've seen her for a couple of years and I'm working with her remotely at the moment. When she came to me, she was very high anxiety and insomnia. And her mother had put her on Zoloft and serotonin when she was 12.
Oh,
Yes. So
how old is she now?
she's 60, 61. Yeah. And she had a fear of chronic fatigue. And so we worked through, and yeah, she was quite fatigued. We worked through most of that. She's not anxious anymore. She's got good energy. She had some problem with her eye last year or year and a half. She had some surgery. And since then, she's had a blinking problem. But I think that there's always been this thing with the gallbladder for her. She's got a sister as well, and the gallbladder comes up as a big issue. I've treated her from different angles, but it always slips from me. I get the blinking down, then her energy slips. Or I'll bring her energy levels up and then the blinking comes back on. And her tongue is looking better, but she had corrugation on the right left-hand side, and just in the upper jaw area. And her pulse is being pretty good at the moment. Like it can tend to excess and tightness in the left guan. But since my work with her, things look good, like the pulse looks good, this looks good, but then the blinking still happens,
And by blinking problem, you mean she can't stop blinking? It's like a tick?
Yeah, it's like a spasm.
This is a bladder sinew or a sinew problem. So this is because it's a sinew problem. That means anytime the sinews are activated. So when the sinews are activated is when there's Wei Qi activation. There's two times. One is Wei Qi activation, which includes sleep cycles, right? And movement cycles. And mood can affect the sinews also. And so I would very much doubt that it's an internal organ problem, and I would be looking at the sinews as the source of that. And I would experiment with testing the sinews to see which sinew is actually involved, because I could be wrong, but it's most likely the bladder because of where the bladder goes. And then I would experiment with sinew treatment. You want to do every day for at least 3 days, and you want to see immediate change. So when you're working with the sinews move like this, they move boom, 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 boom. They don't wait. They're going to respond immediately. So your needle technique has to be quick and superficial. And if you don't see a change in 24 hours, then that's not the correct sinew. So she would need to track the blinking before you start the treatment so you can actually know if there's been a change. Because, people will say no change even when there's been a change, or they'll say, it's changed when it hasn't, because they have no reference point. So for a week ahead of starting treatment, you want her to track every day how many times during the day and when does the blinking happen. And then you want to test the sinews, and you want to decide which sinew you're going to treat, and you're going to treat one, not many, so that you will know. And then you treat it and you see what happens. And it's quick and easy. I don't know. You know how to do the sinew treatments? Anne loves to do sinew treatments. She treated me one time when I hurt my wrist. It's terribly painful, but uh, anyway, that's what I would try because that kind of movement problem unlikely to be the organ, unlikely to be deeper, unlikely to be blood, unlikely to be the deeper ones, not so. And
Thank you.
yeah.
I just looking in that direction at all.
Yeah, well, it will be fun to know. You let me know how it goes because I
Yeah.
love to know. But that's one of the main things I like to help people do is discern which of the channel systems is appropriate because it really makes a difference. And we like people to work on their emotional issues, but it isn't always an emotional problem. Right? Sometimes it's a mechanical problem. The sinews are in a way very mechanical, although they affect mood. They affect mood. And I don't know how much you all have talked about that, but mood different than emotion, right? Mood is temporary. Emotion has story. So mood has no story. They just feel grumpy. They don't know why. Or they feel irritable or sad without knowing why. Emotion has a story. So it's happening on the primaries or the lows. It doesn't happen on the divergence because divergence are characterized by repression out of consciousness. 8 extraordinary, no words, no story. This is way below story, right? This is the deep ocean, the 8 extraordinary. There's no words there. So you can't expect people to talk to you about the experience of Chongmai. You can feel it in the pulse. You can feel it in the way they speak or how they move, but you cannot expect them to talk about it because they're not there. That's not how it works. They can draw a picture. They might even be able to sing a song or do a dance because their essence is capable of it communicating, but not usually in language. So that's just a quick way, one of the ways you can determine, right?
So if it resolves in the first day, I don't have to keep on doing 3 days. Yeah.
Well, because it's a sinew, that
Yeah.
means it's likely to come back 24 hours later, right?
Okay.
But if it's better in those 24 hours, then yes, you should do it enough days in a row that it stays away. And it might take up to 10 days. That's what I would say. Depends how long it's been going on. How many years has it been in place, this activity, right? If it's a habit, it's a sinew pathway, like how when water runs down the hillside, it makes a certain groove, and that groove doesn't change right away. Like the wind blows, it doesn't change that. So if it's been in place I usually say for every year that a condition has been in place, it's going to take a month of treatment at the level recommended.
Okay.
So if it's been in place for 40 years, that's 40 months, 3.5 years at the level recommended. That might be 3 days every month. I don't know. Have to see how she responds.
Thank you.
You're welcome.
Would there be any relationship with it coming back at different times based on her energy? Like I'm just thinking that if it's wind that's coming in the sinews and there's opportunity for the wind to come in, you're more likely to have the tick.
Oh, yeah. And it's more likely to move around. But if it keeps being the same symptom, it's probably the same sinew.
Not necessarily divergent. You wouldn't treat it as superficial, deep,
I
superficial.
would not treat that as divergent. No. Divergent is characterized by having gone away to start with and come back, right? Something is not divergent if it just keeps happening. That's in your awareness. So divergent is a repressed situation. It's a life-threatening situation. This is not life-threatening, right? If the primary symptom is not life-threatening, unlikely to be divergent. Yeah. Yeah. Well, lovely to see you all and meet you all. And anybody have anything they want to say before we close? Thank you. Yeah, well, now you see how much
Thanks
fun.
for your time.
Yes.
And lovely to talk to you. And hopefully we see you in Australia. Yeah, that's a happening thing.
I hope so. Yeah.
Yeah. Cool.
Yeah. Joe will keep you informed.
All right. Thanks again.
Yeah,
Thank you.
you're welcome.
Keep in touch, David. You want to know more? Thanks.
All right, Joe, we'll talk soon.
Okay. Thank you.
Very welcome. Bye.
Bye.